Well, hello everyone, and welcome to our first live webinar follow-up of 2021. So exciting. As the name implies, this webinar, the live stream actually, it is a follow-up to the live webinars that we host every other Thursday. So we have so many great attendees. They have excellent questions, and we want to make for sure that we can get you all of those answers that you're needing. For those of you who may be new, my name is Holly Foxworth. I am a registered nurse and also the marketing manager for content here at Axiom Medical. And then joining us today, we have back our superstar Chief Medical Officer, Dr. Scott Cherry, who's a wealth of information. Dr. Cherry, thank you for joining.
My pleasure. Thanks for having me.
Yeah. Do you want to give us a brief introduction, maybe to give us a little bit of background before we get started?
Sure. My professional background is I'm board certified in preventive medicine, public health, and occupational environmental medicine. I've been supporting either military, government, or corporate industrial operations for the past 15 years. We've been supporting our clients here at Axiom with COVID-19 screening, return to work, and case management since the beginning back in March. Axiom overall has probably now processed and case managed probably about 70,000 COVID cases over that time period, and then countless other contact trace exposures. So I actually get the benefit of working with a quite large team that with our clients' employees, we get a lot of lessons learned as we continue to manage COVID-19 cases and the ever-evolving framework from the CDC guidelines, testing, and infection rates, et cetera. So it's really a pleasure to be able to share some of this information that we're able to garner through that large population health management.
Absolutely fantastic. Yeah, I think that I saw this last week that we had actually close to 3.5 million check-ins as well for the Check-in Work app. So really exciting times, definitely. Well, Dr. Cherry, we're really excited about the upcoming webinar that's going to be going on, the charting the course for the new super COVID strains that's going to be going on this next Thursday. For those of you who haven't registered for that already, we encourage you to do so. I think it's going to be an excellent presentation, give you some great information moving forward. But we did have some follow-up questions that were specific to the framework for the health security for the 2021 workplace that we wanted to address. The first that came from Scott, who was asking how can we encourage or start that intermarrying process of moving forward with OSHA and then the medical and then the personal health that comes along with that.
You know, and as I think we've discussed previously, this really speaks to the idea of what the CDC has coined the total worker health, that takes traditional occupational health and safety services and ideas, and also then personal medical, and how do you intertwine them? And so several large corporations have started working on this in the past decade or longer. And I think now's a great time to start leveraging the benefits of a total worker health approach, because before COVID, you know, total worker health was really, it wasn't fully adopted by every large corporation or business unit, you know, and because corporate wellness, some of the return on investment metrics may be soft or not, may have a longer lag for that return. But with COVID, in my opinion, because of vulnerable populations where we see chronic medical conditions being at much higher risk for severe disease or death, I think the business side or the business analyst side of wellness and total worker health approach is much more valuable to the business as well as to the employee and to society. So start having those discussions with all the different stakeholders in the organization. What we see is that, you know, usually we, you know, with Axiom, we engage with safety or risk, but, you know, those are two different potentially buckets of money that an organization is following. But if you can get higher up to maybe the chief financial officer and have discussions about how total worker health can help with all components of the spend from the company. So for instance, if you have a healthier workforce, there's studies that show lower incidence of injuries. You also have some studies that show increased productivity, which helps on the operational side. Then when you think about health benefits and HR, potentially less turnover, so recruiting has an expense as well as that loss of intellectual capacity. And then also on the health benefits side, healthier people are usually less costly to insure. So you can actually really obtain a tremendous return on investment from a total worker health approach. The devil's in the details always, but I think we really have the place to where we can have a strong conversation now.
Definitely good points. Deanna had asked us several questions. The first was actually how it is that you would manage employees who have been vaccinated or naturally immune to COVID due to recovery. And so he was asking, when they've been exposed for a second time, kind of what is your standpoint there? How is it that you manage those?
Mm-hmm. The CDC has some guidance that's been out for a while that states if you've been infected, essentially you can't be it'd be unlikely for you to be reinfected within 90 days. So I think that's a good foundation of knowledge to create a policy. And so that's with natural infection. And then immune status, we're starting to see some different indicators from the studies that immunity should be at least 6 months and now potentially a year. So those are some of the, I think, key parameters to start putting into your personnel policies, your infectious preparedness plans, and case management. Things change quickly though, and next week we'll be talking about the new strains and if they will have the ability to reinfect someone sooner, and that's very early on, so the data is not strong yet there. But what we're seeing with coronavirus is still been the same. It's remaining very challenging with its ability to mutate. These new mutations have a much higher affinity for infection. So, that's a lot of that is to be determined. But I would say you at least have a 90-day kind of window for natural infection, preventing reinfection, and then 6 months to a year for those that are vaccinated.
Okay, good information. And then the next question he had actually submitted 2 questions to us, and I think this you may have already covered this, but anyways, he was asking specifically, would those that do have immunity, would they need to be quarantined for 2 weeks once they're exposed? So you're saying that wouldn't necessarily be warranted, correct?
Correct. And one maybe detail that I think is important to point out is, as different vaccines are released, it's really important to understand the outcomes by which they're marking their efficacy. The Moderna and Pfizer vaccines, to my understanding, the outcomes that they're tracking is not infection prevention, but severe disease and death prevention. So until we get outcomes or data that show outcomes that would prove infection prevention, you still need to operate as if personnel that are vaccinated are not completely immune to it. So say if someone who's never been infected but gets the vaccine, gets a vaccine that only has data that shows severe disease or death prevention, then you would still need to treat them as they're still vulnerable to being infected and even transmitting it. So I don't think that's been highly visible in the media or in the news, because everyone's very excited about the vaccine, but it's really important to have that in the back of your mind. So a lot of our internal policies with our layered approach take that into account. So that's an important point for our audience to take home.
Absolutely. And just kind of, drilling down a little bit further into that layered approach, because I think that we lose some of this sometimes. The idea is that you still need to continue forth with each of these individual layers, correct?
Yes, I actually feel um, the, the the general public is going to just intuit that, hey, I'm vaccinated, I have kind of a pass to do whatever I want now. And again, based on the outcomes that I've been tracking, that's not necessarily the case. The huge benefit right now to the vaccines is it's going to protect the most vulnerable from getting severe disease and dying from this, and it's also going to protect our health care infrastructure, the hospital systems, to be able to have capacity to take care of those that are sick from COVID and from all the other chronic diseases, acute diseases, and injuries.
Okay. All right. Good information. Michael brought up a great point whenever he was mentioning that Oregon's OSHA independent standards for COVID-19 response was much less stringent than some of those that we've discussed, especially for some of the Cal OSHA perspectives there. So as we've seen in a lot of the legal publications, especially this last week, we've seen a lot of them that have came out and alluding to some of the new changes that we may see with the new administration that's coming forward. So changes on the horizon there. Will we see a new federal OSHA COVID-19 response soon?
I hesitate because I feel federal OSHA has the most challenges in making changes to their promulgated standards, but I do feel that this is probably going to be something that's going to get pushed through. Our chief legal officer, Chuck Cable, talks about OSHA has had an infectious disease protection standard on kind of their short list to do, and it hasn't gotten there. But with COVID, I think that's going to provide a lot of pressure. And with the administration change, I know that the Secretary of Labor, who the OSHA falls under the Labor Department, their designee for OSHA is actually coming from Cal OSHA, I believe, is what I've read. And so I don't know if they're going to be able to pass as stringent as California, the article that I read, but I think it's definitely going to be well positioned to get a significant standard move forward,
I agree completely. I think we're going to see some changes there. The next question came from Sylvie, who was asking about COVID-19 saliva tests that are being sold on Amazon. We've seen that they've now entered the testing market. And so she was asking, are the tests that are sold on Amazon accurate?
What I know specifically is saliva test in general. I may not be totally familiar with what's available on Amazon, but there are studies that have shown that saliva tests have a very high degree of what's the word I want to use? There's a fancy word I was wanting to use, but that's escaped me. But concordance, I believe. There's a high concordance between saliva test and nasal swabbing. So I think in general, across the board, the saliva tests are good to use.
Okay, good deal. Yeah, it looks like that they are offering the PCR test from Dexterity, I believe is the lab that they're using. That's based out of LA County. Yeah, so interesting there. Yeah. All right, and then our final question came from Emily. She was asking what frequency that you would recommend for periodic testing.
So I think there's two fundamental ways to look at this. One, there's a cost to testing. And so depending on your budget for testing kind of can help calibrate how often you test. In general, I think if you want to, what's most valuable is if you can get about 40 samples at minimum per site or per testing cycle. That allows you to run at least some baseline statistics. Once you drop below 40, you kind of lose the ability to apply what they call a normal distribution. But for very large companies that have thousands or tens of thousands of employees, they can do, a 5 or 10% sampling. And it depends on how they're spread. The idea is to try to get surveillance or some data on all of your sites, because you're only going to know where you're testing. So I think usually 10%. What that does when I've consulted with clients is, say, testing 100% of your employees, every month or every quarter or every year may not be feasible. But if you could do 10%, that reduces, by 90%, and then you can spread that over some time periods. Right now we're seeing the highest number of cases per day that we've ever seen in this pandemic. So now's the time to potentially ramp up your testing, or if you're not doing any testing, consider doing some type of sampling strategy of about 10% in your different regions. And then when things calm down, potentially you could, ramp down as well. But I think it depends on your budget, how your employees are spread, if they're spread out or in one facility, and then what's happening in the country or in the region that you're operating from a epidemiological perspective.
Good answer. Yeah, absolutely. So great information, Dr. Cherry, and thanks also to all of you who have tuned in. We've had some great questions this week. Any closing remarks before we wrap up?
So I think I'll just reiterate some of the key points that we were discussing here and on the last week's webinar for this, is that, again, the vaccine is absolutely critical for our way forward in this. It's going to help prevent overwhelming of our hospitals so they can continue to have capacity to take care of us in general and with COVID. Until we get more data about infection prevention from the vaccines, you still want to maintain all the protective measures that you've been doing for yourself, for your family, community, and business, just like if you hadn't been vaccinated. So I would just kind of use this time to reiterate that.
Good information. Yeah. Just a quick few mentions before we go. Again, if you haven't already, please make for sure that you register for the next webinar, which is going to be the charting the course for the new super COVID strains. Dr. Cherry has some great information as usual, but I think we'll definitely have some great tools that you'll be able to use moving forward, answering a lot of those questions that are specific to transmission and whether she should anticipate some of these workplace cases increasing. And then also the impact that the vaccine is going to have, especially since distribution has started. So that's going to be on the 21st at 1:00 p.m. Central. Make sure that you register for that. We do have a white paper that covers the managing the flu strategies during the pandemic. So you're welcome to download a free copy of that from our website. And as always, should you have any questions about checking to work, checking to school, we're happy to answer those and walk you through it. Please don't forget to submit your town hall questions this week. Especially, you can submit those to us by sending them to coronavirus@axiomllc.com. So thanks again for joining. We appreciate you, and we will see you this next Thursday, January the 21st at 1:00 p.m. Central, right there for the webinar. Take care.